Going? Okay. Well, with that said, welcome to today's call. The meeting is being recorded, so again, just please put your phones on mute. If you're using a computer speaker, also mute those computer speakers so we can eliminate any background noise. For those of you only using the phone line, you can actually use the star key and the number 6 to mute and unmute your line. So again, star 6 to mute, star 6 to unmute. At any time during the presentation, I think typically you can chime in with a question, or we'll also be watching chat as well. The presentation slides were sent out just a few minutes prior to 2 o'clock and attached to that meeting invite. So let me know if you don't get those, but again, you should have them. And before I turn things over to Todd, I just wanted to mention everyone that Mountain Pacific has finally finalized our contract with the Center for Medicare and Medicaid Services. That happened earlier this month. So under the new contract, we will support healthcare community coalitions and nursing homes in our 4 states, Montana, Wyoming, Alaska, and Hawaii. More details will be forthcoming, and you'll be receiving an email from me just kind of outlining our upcoming work along with a participation agreement. And we look forward to continuing working with you all to help improve care for our residents. At this time, I also wanted to take just a few minutes to introduce our new program director, Mary Erickson. Mary is not so new to Mountain Pacific, but may be new to all you folks out there in the nursing home world. So Mary, can you just say a few words, give us everyone a little bit of background on yourself?
Absolutely, thanks Marci. It's a pleasure to meet all of you, and I'm very excited to be in this position with Mountain Pacific. I've worked with a lot of organizations in the past 7 years in this role across the state of Montana. So I am a Montana homegrown gal. So I live out in the middle of nowhere between kind of Conrad and Great Falls. So if you know where that's at, along I-15. So that's where I'm at. And my background is in quality improvement and primarily critical access hospital operation. And like I said, I worked at Mountain Pacific with meaningful use and things like that. And then I've been working on an Indian Health Service project for the last couple of years. So I'm excited to step into this new role. Finalized our recruitment materials. And so you'll be getting all of that information about our next scope of work soon. So we'll get rolling, and please let us know what your needs are and how we can best support you in all the important work that you do. Thanks, Marci.
Thanks, Mary. And one staying factor is we will be able to continue with these calls with Todd, Tina, Tyler, Tony, all the T's from the SSA, so which has been very helpful. So without any further delay, I'll turn it over to Todd and Tina.
Thank you, Marci. Tina, do we know if Tina's on the phone call with us today? Tina, are you there?
I do, but maybe she's on mute.
Oh, okay. All right. I'm sorry?
This is Marci, Todd. I see Tina on. Maybe she was just on mute.
Oh, okay. All right. Sounds good. The one thing I've got to let you all know, I do have a meeting at 3. So I will start this presentation out and Tina will finish it. So I might have to, if it goes longer than an hour, hopefully not. But if it does, I'll have to check out and go on to my other meeting, okay? All right, so going on into this information today that we've gotten, these are based on questions that were sent to us. So here's our commitment as a team here for the Department of Public Health and Human Services and our Certification Bureau. And I just wanted to reiterate those. these are all 5 commitments that our team has adopted and want to make sure we're doing every day with our presentations, with our survey process, with our office work and everything. So just wanted to remind you of our commitments, and if you have times where we're not meeting those commitments, you let us know or let me know. I appreciate that. I've got with me as well in the office here Brittany Nelson, who's going to talk a little bit about the nurse aid training program, or the CNA program. So if anybody has any specific questions, I'm just giving you our contact information and what everybody does. I'm not going to spend a lot of time on these, just kind of go through it. Tina is also on the line, and what she does as well, and her contact information. I'd encourage anybody to reach out to any of these folks. Also got Tyler listed on here, and then Tony as well. And then of course my information. Again, if you want to ask questions or you want to pose something to us, you can do it in multiple ways: website, or shoot me an email, call me directly, email me directly. There's a variety of ways to reach me. So the questions we received, the first one was involving the phase 3 requirements that CMS has pushed out. They were adopted some time ago, and they're supposed to be effective November 28, 2019. In the midst of this proposal being pushed out, CMS came up with some revisions to phase 3, which they published some proposed changes in July of 2019, July 13th. So I'm going to kind of go over some of those changes that they proposed. If you're interested in seeing the actual Federal Register, here's the link to it, the URL to go to that directly. But I'll start and kind of summarize what phase 3, where they're at. These are the changes that CMS has proposed after they initially provided it to everyone. So in the residents' rights section.
The number? If it's outside the facility, yes.
Hi, we're getting some background noise. Could I just remind everybody to please mute your phone?
For their
If you don't have a mute button, *6. Can we just get everybody to mute so we will be able to hear Todd clearly? Thank you.
Okay, thank you. So the resident rights section, CMS has proposed, again, these are revisions to the original phase 3 requirements, and they brought up the primary care physician's name and contact information. And what they're looking at there is what is required. Instead of having a list of every maybe specialist, doctors associated with a particular resident, they're just holding them to the primary care physician and being able to provide that, to the resident when needed. So that was one of the changes they're trying to propose, and I'm not sure. Again, these will have to be officially adopted by CMS. I can't remember if they post when they're going to do that, but it will be, as far as we know, it'll be after the November 28, 2019 changes or the implementation of phase 3. So the second one on this same area under residents' rights is the revised grievance policy requirements. And primarily what it was looking at is the records retention time from 3 years to 18 months. So again, a proposed change that they put in place. So in other words, we couldn't ask for more than 18 months if we come in and ask to review the grievances filed in a facility in long-term care. So those are the first two. The third one was quality of care, and it was proposed by CMS to modify requirements for focus on appropriate use of bed rails and eliminate references to the installation of bed rails. One of the key things that they talked about in here is, if a facility purchases beds with rails already in place, there's no practical way to remove them if they're already, part of the bed. So that is one thing they addressed in this section of it, obviously from comments from folks in the long-term care industry. So So that was in the quality of care area. The next one was in nursing services, and it's specific to reduce the time frame that long-term care facilities are required to retain posted daily nursing staff data from 18 months to 15 months, or as required by state law. So it's just a reduction, again, in retention of data. And of course, all of you have to input into the payroll-based journaling system already. So that was the nursing services change. The next one is in behavioral health, and it was to remove requirements that are duplicative of other long-term care requirements in other sections of the regulation and improve clarity. So just some cleanup with the behavioral health area. And again, not to be duplicative later on in other regulations. So then they had, whoops, I gotta go back. They also went into pharmacy services, and they looked at the removal of existing requirements that PRN prescriptions for antipsychotics cannot be reviewed unless the attending physician or prescribed practitioner evaluates the resident for the appropriateness of that medication. So they're addressing that as well. You know, as far as review of that resident. The seventh one is the food and nutrition services area. CMS proposed to revise the required qualifications for the Director of Food and Nutrition Services to provide that those with several years of experience performing as the Director of Food and Nutrition Services in a facility could continue to do so. They also proposed that at a minimum, an individual designated as the Director of Food and Nutritional Services would receive frequently scheduled consultations from a qualified dietitian or other clinical qualified nutrition professional, and then we'd either have 2 or more years of experience in the position of Director of Food and Nutrition Services, or have completed a minimum course of study in food safety that includes topics integral to managing dietary operations, such as, but not limited to, foodborne illness, sanitation procedures, food purchasing, receiving, etc. So that's the change they're proposing there for that section of the requirements for long-term care. The next one was in administration, and this one was proposed to help address concerns related to costs associated with training for the ethics program. So I think they're addressing, and there'll be a section in here that I discuss a little bit more about compliance and ethics. So I'll skip on down to the next one here, which is the quality assurance and performance improvement section of the regulations. CMS is proposing to revise the requirement for facilities to implement a quality assurance and performance improvement program, the QAPI program, by removing prescriptive requirements to allow facilities greater flexibility in tailoring their QAPI program to the specific needs of their individual facility. So they're trying to, remove some of those things that may be felt as difficult to comply with in a different facility. So the next section is on infection control, and they were proposing to remove the requirement that the infection preventionists work at the facility part-time or have frequent contact with the infection prevention and control program staff at the facility. They will instead require that the facility must ensure that the IP, the infection preventionist, has sufficient time at the facility to meet the objectives of the IPCP. So I think that's the infection control and prevention program, control program. They're not saying it has to be at least half-time or part-time or whatever, but they are saying as long as the program is functioning and the infection control program is working effectively, they're not going to question the time. Is there enough time for that person at the facility? So anyhow, so that was the infection control. The 11th one is about compliance and ethics program. They're proposing to remove many of the requirements from this section not expressly required by statute. So I believe they've determined that some of it they could not require, so they're removing it. So proposed revisions include removing requirements for a compliance officer and compliance liaisons, and revising the requirement for reviewing the program from annually to biannually. So that's as far as the ethics program and compliance program. Then the final one is the physical environment. They did add some clarity that you could continue to use the 2001 fire safety equivalency system, the FSCS, and their values when determining compliance for containment, extinction, and people movement requirements. This proposal would allow other older facilities who may not meet the FSCS requirements in the recent adopted 2012 Life Safety Code to remain in compliance with the older FSCS without incurring substantial expenses to change their construction types while maintaining residents and staff safety. So they're allowing the use of that older version of that system. It also revises requirements that newly constructed or reconstructed or newly certified facilities accommodate no more than 2 residents in a room and equip each resident room with its own bathroom that has a commode and sink. Specifically, they're proposing to apply this requirement to newly constructed facilities and newly certified facilities that have never previously been a nursing home. This would remove unintended disincentives to purchase facilities or make upgrades to existing facilities. So those are the couple of areas that they are trying to provide a little bit more leeway in the physical environment. There's some additional things that have come out of this proposal as well, involving the informal dispute resolution, or IDR, and the independent informal dispute resolution. And it deals with, they're proposing to revise the informal dispute resolution and independent informal dispute resolution process to increase provider transparency by ensuring that administrative actions are processed timely and the providers understand the outcome of the result. So they're improving some of that response they may have to you as providers. Then with civil money penalties, they are also talking about, and under the civil money penalties, they're talking about waivers of the hearing and reduction of the penalty amount. And so what they're proposing here with this particular area is to eliminate the requirement for facilities to actively waive their right to a hearing in writing and create it in its place a constructive waiver process that would operate by default when CMS has not received a timely request for a hearing. The accompanying 35% penalty reduction would remain. This proposed revision would result in lower costs for most long-term care facilities facing civil money penalties and would streamline and reduce the administrative burden for stakeholders. Phase 3 implementation of overlapping regulatory provisions. So this particular part is just, again, these were 2 areas that they also looked at besides the regulations specifically for long-term care. So then heading into the next item on phase 3 provisions, again, this came out July 18th, 2019. They asked for comment. They closed comment September 6th, I believe. And so right now they're reviewing all the comments, all the information provided, and addressing all those comments. And so we're waiting for the final notice. Again, it's predicted to come out definitely after November 28th of this year, when phase 3 is supposed to be put in place. And so just so you're aware, the 3 areas that they're looking at impact on these are the designation and training of the infection preventionist, QAPI, and then the compliance and ethics program. So these are the major changes that they're going to institute with this change. But what does that mean overall for phase 3? For phase 3, they'll still go forward with the requirement for an infection preventionist, and that they have, you know, meet one of these 4 areas that are listed. I think, well, all 4 of the areas, I guess. They have to qualify with all 4 of these items in place. And then they also have to participate in a quality assessment and assurance committee, the infection preventionists themselves. So it doesn't eliminate the requirement for that infection preventionist, but it does change some of the requirements that I went over previously. And how that, you know, as far as, I think one of them being, if we go back, it was part-time versus if they're on staff and they can ensure the infection prevention program is sufficiently taken care of. They're not going to look at how long minimum they have to be on site. So then the next item too to keep in mind, the QAPI changes. They do still include having that infection preventionist, as I mentioned before, being part of the QA or the QAPI program themselves, is in addition to the director of nursing, the medical director, and 3 other members of the facility staff. So then that's a lot of information, and really the regulation is so if you look at the Code of Federal Regulations, there's a lot to it, and they provide you the comments they received, and they provide what they're doing and how they're addressing them to some extent. But if you have questions about it, you're welcome to let us know, and we'll try to get you an answer. We're really waiting as well to get a final version of it, you know, issued out by CMS. And to be honest with you, we have not received an update to the Aspen system that would include the infection preventionist in it. So, you know, to include the new tags that they're going to require for it at this point as well. So, not to say we won't look at it, but it's, you know, it's going to be harder for us to cite anything associated with the infection preventionist and this new phase 3 requirements until they finalize everything. So I don't know if there's any questions specifically on that, on those phase 3 requirements. We've also written an article that's in our newsletter that's very similar to what I just presented to you. So if you want to have, you know, want to see additional information on it, if you're not receiving our email, just drop us an email, or not receiving our newsletter, just drop us an email at mtssad@mt.gov, and we can send you on a link to it or a copy of it so you can review that. So is there any questions that I can answer?
Todd, this is Marci. I was just thinking, do you want to send me that link and that information, and then I'll just blast it out to the group, because there are folks here that probably aren't on the call would be interested in that if they're not receiving.
Okay,
it.
sure. It's actually in the front of our presentation, the MTSSAD. If they can just email us and say, I'd like to receive the newsletter. Unfortunately, we don't have it on a like a listserv or something like that, where they can add and subtract, you know, take their names on and off. We're looking at that, but we're not there yet.
Okay, so what is the most recent newsletter you guys have completed?
We had a fall 2019.
Okay.
So it just
All right.
came out. We're talking like a week ago or so.
Okay.
So,
maybe
okay.
I'll attach that and then the link to sign up to get those.
And I think, did we forward you a copy of it?
Well, I don't remember receiving that, Todd.
Okay. We'll forward you another a copy of it, okay?
That would be great. Thank you. And then I'll get it out to everyone.
Okay. That's all I had. And what I was going to do is let Brittany step in now for the nurse aid certification process. We were just going to remind you that the renewals are now for every 2 years. We started that in April of this year, 2019, and it will finish up with getting everybody on that 2-year renewal by April of 2020. And then another reminder, there is no grace period for renewal of CNAs. It's the 15th of each month is the deadline. So they need to renew their license or their certificate or registry with us by that time. Otherwise, they take chances of having to retake the test and go through the whole training process and everything. So remind your CNAs out there. And then we do have frequently asked questions on our website as well that may help with some of their questions. And then address changes, that's the key thing for us. We do mail out a renewal or a card to remind them, but we get a number of them back every time because people don't keep us up to date on their renewal or their address, excuse me. So they can just submit an address change to us at that CNA@mt.gov, and we can get them changed in the system. So, okay, I said I'd let Brittany go, and here she is. She's ready to go. I'll let her answer this question for you.
So the question came in that they were wanting to know if we could put some additional training, if we could track the training on the certificate, and what that would take as far as continuing education on their actual certification. At this time, the database we use doesn't even print a certification. We don't have a paper copy or a hard copy of a certification. It's just the online verification page. Federal requirements don't tell us that we need to track continuing education for CNAs. That would be in the facility. That's part of the responsibility of the facility as far as that goes. But the registry itself doesn't have to track those, so we have not built that into our database at this point. Like you said, we have been looking at alternative databases recently, and it's kind of I would say a division, if not agency-wide effort to look at the computer systems that we're currently using and if changes need to be made. But if those are made, they are several years down the road right now. So. The other thing I will say is there was some confusion as to April of 2019, renewals went to 2 years. People thought that automatically gave them 2 years. If they expired in 2019, they were given till 20. No, that's not right. If you expire in 2019, you have to renew to get the 2 years. So we've had a lot of confusion with that, and we've had a lot of questions on that as well.
Thank you, Brittany. Is there any questions for us on the CNA registry?
Todd, there is a question in chat about where do the CNAs send information for name changes?
Oh, yeah. So the same thing, they can email that to our email cna@mt.gov. We just require a copy of the legal document that changes their name, so marriage license, divorce decree, anything like that. We need a copy of that emailed to us, as well as their name and their certificate number as well.
Okay, any other questions for us on the CNAs? All right, I'll go on to the hospice. The questions for hospice that it came up this time was do we have any updates of the regulations? And there is currently a code of federal, or excuse me, a federal registry rules that are out there that are going to be effective November 29th. So, not too far away here. And primarily, I'm going to summarize where the areas of interest for the group would be. There are some medication management changes there that they proposed and put in there, removing requirements related to having on the hospice staff, the individual with special knowledge of hospice medication. So they eliminated that. The orientation of the SNF, so skilled nursing facilities, and ICF-IID, which is we don't have those facilities in Montana anymore, but we do have SNFs, certainly. Revising requirements to explicitly require hospices to coordinate with SNFs and NIFs for assuring orientation of facility staff. So to make sure that they're oriented as to what their hospice patients in the facility or residents in the facility need and being familiar with that. It also talks about the hospice aid training and competency. So it removes the requirement for a state licensing program, which we don't have in Montana to begin with. Well, yes, we do, I'm sorry. To meet specific training and competency requirements in order for such licensure to qualify a hospice aid to work as a Medicaid participating hospice, deferring to the state licensing requirements. So we do have those in place, and it is tied with the CNA program here in Montana. And there are specific requirements there if somebody's interested in becoming a hospice aid. So the final one is emergency preparedness, and they talk about addressing requirements and updates as well as testing for hospices that provide care in patients' homes. So it's looking at that as well for emergency preparedness for those that are hospice residents in their home. So it's a little more than maybe was anticipated. We do have at least 3 hospices that are a facility where they have hospice residents in a, almost like a long-term care setting, independent of long-term care. And they have to be, they have to go through the emergency preparedness part, but they're also saying now that it has to be addressed for patients' homes as well, for those that are out in a community or out away from a hospice program. So those are the ones we're aware of. We give you the link to that, and if somebody wants it specifically, they can just email us, and we'll give you that. Again, it's code of, or it's the Federal Register, so there's a lot of detail and information maybe that isn't all pertinent, but it's a good thing to start looking at and getting ready for. And then the next, so is there any questions on that hospice section? Those are the only changes that we're aware of right now. Okay, I'll just go ahead then and turn it over to Tina and let her take over the abuse reporting questions that came in.
Can everybody hear me?
Yes.
Okay, alrighty. So,
Tina, you may want to, if you are logged in from your computer, maybe just mute your computer speakers or turn that volume down. We're getting a little bit of an echo.
how is that?
That's better.
Okay.
And then I think,
yeah.
I don't know if you want to have Todd stop his screen share, or maybe Brittany's in the same room. She can advance the slides for you. Otherwise, I think we're going to have to flip it over to you so you can advance your slides.
It doesn't matter. I can share my screen if you want.
Todd, do you just want to stop sharing, and then we will get Tina to share her screen so she can advance.
Sure.
Rest. Okay. Looks like you're on, like the last slide, Tina.
Mm-hmm.
We can see your screen though.
Yep, it won't let me come off of that one. Yep, it's not letting me advance it.
Okay, do you want to stop your screen share and I can pull up the presentation and advance them for you?
Sure, that would work great.
Okay. Let's see here. Okay, can you see the slides now?
Yep.
You just want to tell me which slide to start on, Tina?
Yeah, you're gonna finish down through the CNA information and start with the abuse question with the 24-hour timeline. So can you go into the presentation mode for me?
Can you see that okay?
Yep, it's looking good. Okay, one more, I think. More. Oh, two more, okay. Right there.
Okay.
Okay. So we received 2 questions in the office about the timeline for reporting of abuse. The first question had to do with the 2-hour timeline, and many people feel that if it's not abuse, that they should have the 24 hours to rule anything out as far as the reporting requirements. Unfortunately for F609, there are not really any leeways given for this regulation. 483.12 clearly shows that all alleged violations that are involving abuse, neglect, exploitation, or mistreatment, including any injuries of unknown source or misappropriation of property, have to be reported immediately and not later than 2 hours. That because the surveyors are providing oversight, we must adhere to that specifically. If the event is not abuse, as shown in the examples above, and do not result in the serious bodily injury, CMS does allow a timeline up to the 24 hours for a facility to take a look at it. But if it meets that criteria as shown above, it definitely has to be reported in those required timelines. Next slide. We received this question, which was a little bit confusing about, please continue to educate on the reporting guidelines for abuse. So when we receive very specific instances, it's hard to explain because the regulation is so comprehensive. But the state operations manual outlines the requirements for abuse and reporting. And we use these to provide the oversight for regulations. And because each situation is very unique related to abuse, we are hoping that each facility has a very good understanding of the requirements, and they take their policies and procedures that hopefully are meeting the requirements, and then they operationalize those policies and procedures for resident protection. If you have questions that are very specific for us, we are happy to answer those if we can. And we will continue to provide education moving into the future as we get information that we can hopefully provide responses to. But really, we fall back on the regulations themselves when it comes to not only educating, but then also providing responses for our questions. So this one was just a little too generic to come up with a clear response. But if you do have any questions, please let us know specifically, and we'd be more than happy to respond to those. And the next slide.
Hey, Tina, this is Todd. Can I add something there?
Uh-huh.
Sure. The other thing is we're being told by CMS the process of reviewing everything and before they produce it to us or to give us direction is somewhat slowed down. So we're waiting for some guidance from Chapter 5 of the State Operation Manual that will direct us in the initial reviews of what they were providing did give us some examples or give us, both the facilities and the surveyors some examples of what was not reportable. So we're hoping that stays in there, but we're not sure, and then hopefully clarify for facilities when they have to report, when they don't, or what examples are of things that don't need to be reported. So bear with us. We're waiting for it as well, and as soon as we get it, we'll certainly share it.
Thank you, Todd. All righty, next slide, please, Marci. So the level 1 and level 2 and the pre-admission screening assessment are two different items, and we received questions on both of them. The first one was about the level 1 and the pre-admission screening assessment. And the second one is, should the hospitals be completing the level 1 screening prior to a long-term care admission to determine if it's an appropriate placement? So as what I did is in the upcoming slides is I took some important information from the regulations, both state and federal, and then I also combined them together in the presentation for everybody to use in the future if they need to, just as a reference. And next slide, please, Marci. So to start out with, the administrative rules of Montana show for the pre-admission screening and definitions that a level 1 is a review of a nursing facility applicant to identify whether the applicant has a primary or a secondary diagnosis or indications of mental retardation or of mental illness. A level 2 screening is specifically an assessment that is applied to the persons identified as having these primary or secondary diagnosis of the mental retardation or mental illness. And next slide. That shows the difference between the two. In the state regulations, it shows that the pre-admission screening, which is your PSAR, means a medical, psychological, and social evaluation of a nursing facility applicant, and it is to be performed prior to entry to a nursing facility or home for community services. So that specifically shows that it's supposed to be completed prior to an admission to a nursing facility. Next slide. In F644 of the State Operations Manual, this is where you look at the federal regulations specifically, it talks about how the facility must coordinate pre-admission screening assessment to ensure that the Medicaid services are covered. And so I just provided a few references in there. These are actually the regulatory language that are showing on this page. And it talks about the PSAR and also the level 2. And I would recommend that each facility, if you have questions about this regulation, go in and take a look at it. And that way you'll know specifically what it's going to expect. And the next slide, please, Marci. The level 1 screening is used again to determine if an applicant has a diagnosis or indication of the mental illness. And then the level 2 screening, if an applicant is found by a level 1 screening to need further assessment. And then a nursing facility screening is determining if an applicant needs actual nursing facility services. So these are those three things that we're talking about: the level 1, the level 2, and the pre-admission screening. So your level 1 is your initial assessment that's done or screening. Your level 1 is going to tell you whether or not you need to do a level 2. And then the facility is going to complete the pre-admission screening assessment to show whether or not that resident actually needs the services the skilled nursing facility is going to provide. Next slide, please. So for the pre-admission screening requirements, the state regulations show that the rule provides the pre-admission screening requirements of the Montana Medicaid program for applicants to nursing facilities participating in the Montana Medicaid program. So if your facility is certified for Medicare or Medicaid, you fall under this requirement. And for the second part of this, the nursing facility applicants must undergo a level 1 screening prior to admission to a nursing facility. So this is the second time now the state has mandated that the level 1 must be completed prior to a resident's admission to a nursing facility. Next slide, please. I put a picture of an example of the current Montana level 1 screening here, just so you can recognize it. But for the state regulations, it also shows that a nursing facility applicant who has a diagnosis or indications of a mental retardation or illness may enter a nursing facility only if the applicant is determined to be in need of the facility services and is allowed to enter the facility as provided for, and then it shows in the rules the different requirements. And so there's a lot of information in the state regulations that it goes into for this. But just so you know, if you admit a person who meets the criteria for level 2, that person is going to have further assessment to show that their services are being provided adequately to meet that resident's need. And next slide, please. If a resident has a change of condition anytime during their stay, the facility has to determine if a new level is needed to be completed due to the resident's change. This should be considered when a surveyor is reviewing the level 1s and 2s, and this is what we train them on. So if you have a resident who all of a sudden they're admitted to the facility and they've been there for, let's say, 6 months or a year, and they start to display new behaviors and new problems, and they end up going to the physician, and they now have a brand new diagnosis that meets that criteria of a level 2, then you would want to initiate a new level 1 and then also prompt the completion of a level 2 and further assessment for that resident as needed. So don't forget when you're doing your change of conditions that you need to consider those updating of your level 1s as needed. And the surveyors do take a look at those now. And the next slide, please. So for the pre-admission screening, this is the state regulation here that I have on this slide, so you can find the number here. For elderly people and physically disabled persons, the need for nursing facility services will be determined based upon the following criteria. And then that criteria is listed specifically in the state regulations. The services of a skilled nursing facility are needed when a person meets the criteria for skilled care as defined, and then it shows you the title of the Social Security Act. And there's a lot of information, and most facilities are pretty good about making sure that they don't provide services to people who don't necessarily need that care. So if you really need further information on it, I suggest you go in and take a look at this, but the state regulation is pretty comprehensive on the requirements for the Social Security Act to make sure that each facility is meeting those resident needs. Next slide, please. Marci, you're doing great, by the way. The Medicaid recipients must be determined by a pre-admission screening team to require nursing facilities before Medicaid payment for services in a nursing facility or the home and community service program is authorized. So again, this is in a different part of the state regulations that it's showing you that that must be completed before Medicaid payment is being done. If a person is Medicaid eligible prior to admission to a nursing facility, the nursing facility screening must be requested prior to admission. Payment for nursing facility care is effective as the date of the resident's entry to the facility if the facility meets all of the eligibility requirements. So then, if a person applies for Medicaid while they're a resident of a nursing facility, the nursing facility screening must be done, again, prior to initial Medicaid payment. The payment then is effective on the date the nursing facility screening or the date of referral to the pre-admission screening, whichever is earlier. So these are all different components of the state regulation that outline when and how you're supposed to complete your pre-admission screening assessment. And the next slide, please. In the state regulation, it talks about the redetermination of the need for nursing facility persons or nursing facility services. And for a person who is identified as in need of nursing facility services and enrolled in home and community services, a redetermination of the need for nursing services is going to take place 90 days after enrollment and every 180 days thereafter. So if you have a person who's living at home and they come in, they are going to continue to do those redeterminations. And so I just added that in there so everybody is aware of that. So again, a lot of those are actually the state regulations. And then I also provided some of the federal regulations for review also. And next slide. Any questions? No?
Hello, can you hear me?
Yeah.
Hi, this is Pam. I'm with Mountain Pacific Quality Health, and I just wanted to encourage everybody, if they do have questions regarding the level 1 process and the Medicaid screening level of care, you're welcome to call us anytime, and I can give you that number if you like.
Hey, Pam, this is Marci. I'll go ahead and just put that in chat.
Our number?
Yeah. Do you have a direct line other than our toll-free?
Our 800 number is 800-219-7035.
Okay, no extension?
That'll get us to the department, and then if a reviewer needs to be summoned, we can take care of that.
1-800-219-7035.
Right.
Thanks, Pam.
Mm-hmm.
Okay, any other questions?
I'm not seeing anything in chat. Does anybody have anything on the phone that wants to chime in with a question?
And again, anybody can send us any questions. It's good to answer individualized questions sometimes to really look at the situation. But feel free to send us that information as needed.
Okay, well, if no other questions, again, you can always contact Pam Yeager at Mountain Pacific for any of those Pass Our questions, or again, anything about the presentation. Feel free to reach out to Todd and Tina, and thanks everyone for joining us today. Our next call is on the calendar for February 13th of 2020, so after the first of the new year. We'll give you back a good half hour of your time, and we'll go ahead and keep these scheduled at an hour and a half just in case we do need more time. Thanks everyone for joining us today.
Thank you, Marci. Thanks everybody. Have a good afternoon.